Good morning. It's Friday morning, January 29th. We're at O'Hare Airport awaiting our flight to San Juan, where we'll connect and get to Santo Domingo.
An opportunity came up to go into the Dominican Republic, into Santo Domingo, to the charity hospital there. Was being overrun with Haitian refugees, families that had survived the earthquake and were able to pull family members out of the rubble that were injured, were making their way across the border and into Santo Domingo, where the Dominicans were graceful enough to allow the Haitians to be treated in their hospital. I spent my life in the military learning how to set up field hospitals, learning how to do disaster medicine. And when this opportunity came up, I thought that I can help. I have a skill set that is probably unique, experiences that can help contribute to maybe helping some of the Haitian survivors. There was a spine surgeon from Northern Illinois, Jesse Butler, who was down there, had been down there a week and had to come back to the States, and I was basically sent down to be his replacement. They had a team of 12, and we were replacing them with a team of 4 from Northwestern, myself, Dr. Gill, an anesthesiologist, and 2 ward nurses. We went down there and took over for this team. And though we had limited skill sets, the 2 nurses had very little experience in the OR. We were able to teach them quickly on the fly on how to assist in surgery, and they did a wonderful job. This is the second spine surgery case that we did. We're doing a fusion of a neck fracture in someone that's a quadriplegic, but whose neurologic injury is not totally complete. The biggest challenge is flexibility.
Do we find cerebellars?
Yes.
You're used to dealing with trained people, certain instrument sets, and here we basically had a scattering of instruments.
We got something a lot smaller?
Smaller, yeah.
So we had to improvise on the fly to make things work. People had to step outside their comfort zone, and it was amazing how many people were willing to help and did wonderful things and assisted greatly.
This is one of the patients that was operated on earlier in the week. She has complete spinal cord injury and doesn't have any family here at all. She's here by herself, so.
Mama's taking care of her.
So some of the other families that are here, including Mama,
right?
are taking care of her.
This is her first time outside the hospital since the earthquake, so just about a month later. And we finally have gotten her into a wheelchair. If you look closely at this is a wheelchair that's made out of a plastic lawn chair with some wheels attached to it. That was made by one of the relief agencies and sent down there. Typical example of the devastation to families at multiple generations. Here is a young woman who survived the earthquake. He had to be a teenager just by the way that she looked. And you can see here that she had sustained an injury to her left leg, then they had to have it amputated above the knee. And this is her daughter, who also survived the earthquake and had to have an amputation below the knee on the right leg. And I think that they were the only survivors from that family. These are the lucky people. They were able to make their way to a functioning hospital. And thankfully, many people from around the world were able to get down there to help the Dominicans take care of their neighbors. A lot of people gave in a lot of ways, and though I was able to actually go down there and do things hands-on, it was not just myself that was there doing it. It was many people in a long supply train all the way back to Chicago.